July 2, 1944, underground hospital cave near Cherbourg, France. The white medical coat hung loosely on her shoulders as Drive.schwestern emerged from the subterranean darkness, her hands raised in surrender, squinting against the harsh daylight she hadn't seen in days. The Americans cannot possibly have the medical supplies they claim. This must be propaganda to break our morale. These words spoken to her fellow nurses just hours earlier in the cave hospital carved deep beneath the fortifications near Cherbourg would soon prove to be the first of many shattered assumptions. Behind her, 8 other German army nurses followed into the sunlight. Among the first German nurses captured by American forces during the invasion of France, they had spent the final days of the siege treating wounded Wehrmacht soldiers by candlelight, rationing their last vials of morphine, boiling and reboiling bandages for reuse. What none of them knew was that within hours they would witness medical capabilities that contradicted everything they had been taught about American weakness and German superiority. The 9 nurses, captured after treating casualties in conditions that resembled medieval surgery more than modern medicine, were about to experience a medical system so advanced, so abundantly supplied that it would shatter not just their medical understanding, but their entire ideological foundation. Colonel Richard P. Johnson, commanding officer of the 45th Evacuation Hospital at Lam, studied them with curiosity rather than hostility. Enemy medical personnel yet fellow healers. Within days, these nurses would be returned to German lines under Geneva Convention protocols. A total of 16 German nurses would be exchanged on July 2 and July 9. But first, they would witness American medicine in 1944. Medications they had only heard rumors about, surgical techniques beyond their training. The psychological impact would last far longer than their brief captivity. The unraveling had begun over a year earlier on May 13, 1943 in the scorching heat of Tunisia. General Hans Jürgen Von's surrender included not just combat troops but thousands of medical personnel, doctors, orderlies and among them DRK-Schwestern, German Red Cross nurses who had served with Rammel's Afrika Korps through 2 years of desert warfare. Among the captured was DRK-Schwestern Ilse Schulz, who had received the Iron Cross Secondasse in April 1943, one of fewer than 20 women ever to receive this decoration during the war. Her colleague, Dr. Schwester Grete Fock, also decorated with the Iron Cross in April 1943, kept careful observations that would later be discovered in German military archives. The Americans throw away more medical supplies in a day than we received in a month. They have medicines we have only heard about. The scale of the surrender was staggering. Between 250,000 and 275,000 Axis troops, including medical staff from elite divisions like the 21st Panzer, the 15th Panzer Division, and the 90th Light Division, while most captured medical personnel were male doctors and orderlies. The nurses among them would experience a particularly profound ideological shock. The American processing followed strict Geneva Convention protocols with remarkable efficiency. At collection points in Tunis, American medical officers sorted captured medical personnel within hours. Those needed to treat German wounded were retained. Others were marked for evacuation. Every captured nurse received a medical examination using equipment that had become scarce in the Afrika Korps. By June 1943, the first groups of captured German medical personnel were boarding Liberty ships for transport to the United States. These mass-produced vessels themselves contradicted German propaganda about American industrial weakness. The ship's medical facilities exceeded anything German nurses had seen in their homeland. Operating theaters with consistent electric lighting, functional X-ray machines, and refrigerated medicine storage were standard. Most striking were the blood plasma supplies, properly typed and stored units that could be administered safely, unlike the risky direct transfusions German forces attempted in field conditions. The two crossing revealed American medical abundance daily. Sulfur powder rationed by the grain in German forces was used liberally. Bandages were disposed after single use. German medical personnel who had survived on minimal rations watched American medics discard uneaten food portions, waste that would have been unthinkable in the Wehrmacht. Ships carrying German medical personnel docked at ports from Norfolk to New York. Their first glimpse of America contradicted years of propaganda about a nation supposedly weakened by economic depression. At Norfolk Naval Base, medical processing included comprehensive examinations for all captured personnel. Dental work was performed, infections were treated, and those needing corrective lenses received them. This level of care exceeded what was available to German civilians. The rail journey inland provided continuous revelations. City after city displayed illuminated hospitals. In Richmond, the Medical College of Virginia complex was visible from the trains. In Philadelphia, Pennsylvania, hospitals' imposing structure could be seen. Every urban center possessed medical facilities surpassing those in major German cities. At a Washington, D.C. stop, American Red Cross volunteers boarded to distribute packages to German POWs. Toiletries, cigarettes, chocolate, writing materials. German nurses indoctrinated in racial struggle ideology struggled to comprehend this kindness toward enemies. Camp Opelika, Alabama opened in September 1942 and received its first Afrika Korps medical personnel in June 1943. The camp hospital became a unique environment where German medical staff trained in Nazi racial medicine worked alongside Americans, practicing clinical medicine. The dual staff system followed Geneva Convention requirements. American medical officers supervised while German personnel provided direct patient care. This created an unprecedented situation. Enemy medical staff operating within the American military medical system. The facilities astounded German nurses. Operating rooms contained equipment they knew only from textbooks. Electric cauterization, adjustable surgical lights, rapid sterilization autoclaves. The pharmacy held hundreds of medications in climate-controlled storage with expiration dates years away. On July 21, 1944, Glennan General Hospital in Ocmulgee, Oklahoma became German prisoner of war General Hospital No. 1 with 1,690 beds staffed by parallel American and German medical teams. Colonel Henry W. Misch implemented something unthinkable in Nazi Germany. Integrated medical teams sharing knowledge across enemy lines. German nurses from the NSA shaft, who had been taught American medicine was weak and corrupted, discovered a system based on rigorous, scientific method. Most challenging to their worldview were the African American nurses assigned to P wards, a result of U.S. military segregation that relegated black nurses to treating enemy prisoners rather than white American soldiers. German nurses observed these professionals providing skilled care that contradicted every racial assumption they had been taught. Nothing demonstrated American medical superiority more dramatically than penicillin. In 1943, the United States produced 21 billion units. By 1945, production reached 6.8 trillion units. German medical personnel operating without effective antibiotics witnessed routine use of this miracle drug. At Camp Forest in Tennessee, which housed German POWs and included extensive medical facilities, German nurses observed transformations they considered impossible. Infections that meant certain death in German field hospitals cleared within days, where German surgeons would have amputated. American doctors saved limbs. American medical officers, many civilian doctors in uniform, shared knowledge freely. This openness toward enemies contradicted everything German medical personnel had been taught about warfare and medicine. The American blood plasma system represented another leap beyond German capabilities. Proper typing, cross-matching, and preservation prevented the often fatal reactions from direct transfusions still used by German forces. At facilities like the 21st General Hospital at Ravenel, France, where captured German staff worked from December 1944, the blood supply system operated with industrial efficiency. Plasma stored for months, transported thousands of miles, administered without knowing blood types. Capabilities that German medicine hadn't achieved. German nurses trained in the Schwestern shaft had learned that medicine served racial improvement. Their education included herb and race and heredity and racial studies, teaching that weak patients should be eliminated to strengthen the race. At facilities like the 12th Field Hospital's 30,000-bed P operation, they witnessed the opposite. American medical staff treated German prisoners identically to American wounded. Enemies received the same scarce medications, surgical procedures, and nursing care as Allied soldiers. This fundamental difference, medicine as universal healing versus racial tool, began demolishing their ideological framework. Christmas 1943 delivered profound psychological impact. American organizations sent 500,000 packages to German POWs. Each contained wartime luxuries, coffee, chocolate, cigarettes, soap. At Camp Alva, Oklahoma, designated for Afrika Korps personnel, local churches sang German carols. Boy Scouts delivered handmade cards. Families with sons fighting in Europe sent homemade treats. The Christmas feast. Turkey, ham, vegetables, deserts exceeded anything German forces had seen in years. German nurses documented their confusion, enemies showing Christian charity while their own propaganda preached hatred. By 1944, the Special Projects Division implemented the teaching method itself, encouraging questions, debate, disagreement, contradicted their hierarchical training. Access to American medical literature revealed another shock. Many German medical advances had been developed by Jewish scientists expelled by the Nazi regime. The cognitive dissonance was overwhelming. As American medical personnel deployed to Europe, German nurses increasingly staffed military hospitals. At the 45th General Hospital in Bari, Italy, receiving German prisoners on July 31, 1945, they worked under direct American supervision. Colonel Charles A. Pfeffer's hospital treated all nationalities equally: Allied soldiers, Italian civilians, German PSWs. German nurses found themselves using American techniques and medicines to treat patients their ideology had deemed inferior. American medical technology seemed decades ahead. X-ray machines scarce in Germany were routine. Electrocardiographs, unknown to most German nurses, were standard equipment. At facilities like the 3rd Convalescent Hospital operating from May to September 1945, German nurses learned equipment operation they had only imagined: autoclaves sterilizing in minutes, not hours, electric suction replacing hand pumps. Even simple innovations like adjustable beds represented advances. Spring 1945 brought the most devastating revelation. Liberation footage from concentration camps was shown to German POWs. Medical personnel who had served the Nazi regime faced the ultimate moral crisis. Initial denial crumbled as evidence mounted. Testimony from American medical officers entering camps, photographs, letters from Germany confirming the truth. They had served a system that perverted medicine into murder. American officers handled this professionally, emphasizing that medicine itself wasn't guilty, but must never again serve ideology over healing. American authorities implemented targeted denazification for medical personnel. Mandatory courses covered medical ethics and democratic principles, using case studies showing how racial medicine harmed patients while scientific approaches saved lives. Lieutenant Colonel Dorothy Whitman at Camp Opelika arranged for German nurses to observe American nursing practices, emphasizing documentation and patient advocacy. The message technical skill without ethical practice was insufficient. Throughout captivity, American medical abundance stunned German personnel. Hospitals discarded barely expired medications that Germany couldn't produce. Instruments were replaced at first where signs rather than repeatedly repaired. This waste demonstrated a truth contradicting Nazi propaganda. America produced medical supplies in unlimited quantities without conquering territory. Germany fought for resources that America created through industry. American nursing practice challenged German professional identity fundamentally. Nazi hierarchy demanded unquestioning obedience. American nurses functioned as thinking professionals with significant autonomy. They could question doctors' orders, suggest alternatives, make independent decisions within their scope. This professional model, unknown in German nursing, represented a complete reimagining of their role. Captain Helen Morrison at Glennan explained, "You're responsible for patient outcomes. If something's wrong, speak up regardless of hierarchy." This empowerment transformed their understanding of nursing itself. African American medical personnel's presence created profound cognitive dissonance. German nurses worked under black professionals demonstrating superior knowledge and skills. Lieutenant Elenina Powell at Camp Florence, Arizona supervised German nursing staff with professionalism that contradicted racial propaganda. When she corrected techniques or taught procedures, German nurses confronted the falsity of their racial education. The irony wasn't lost. American segregation assigned black nurses to enemy prisoners. Yet, even this flawed system produced better outcomes than Nazi racial medicine. After Italy's September 1943 surrender, cooperating Italian medical personnel received better treatment. German nurses watched former allies gain privileges while they remained restricted. This pragmatic approach, judging current cooperation over past allegiance, contrasted with rigid Nazi ideology. Italian nurses worked freely while Germans maintaining Nazi beliefs stayed under guard. Despite prisoner status, German nurses received medical education exceeding their homeland training. American officers taught new techniques, medications, and equipment operation freely. Knowledge was shared without restriction. burn treatments from Pacific experience, surgical innovations from European combat, all taught to enemy personnel. German nurses documented everything, knowing they'd return to a destroyed nation needing medical expertise. As war ended in May 1945, American authorities prepared German medical personnel for repatriation through comprehensive training. Courses covered public health, epidemic control, emergency medicine, skills for rebuilding Germany's medical system. They learned water purification, mass vaccination, malnutrition treatment. Colonel Richard Stevens told them, "You're returning to massive medical needs. This knowledge is our investment in democratic Germany." Training included establishing clinics with minimal resources, training auxiliary personnel, implementing public health measures. German nurses received certificates documenting their American training, credentials valuable in occupied Germany. German nurses returning between 1945 to 1946 found 60% of German hospitals destroyed. They brought not just American techniques but fundamentally different medical philosophy. Former PWS established nursing schools emphasizing patient advocacy over ideology. American protocols were implemented in rebuilt facilities. Blood banking systems copied from American models. Systematic antibiotic use following American guidelines. By November 1945, with minimal American medical personnel remaining in Germany, these American-trained Germans became essential to public health maintenance. The influence extended beyond immediate post-war years. By 1950, many German nursing schools were led by former PWS. They introduced concepts learned in American camps: nursing diagnosis, patient advocacy, continuous education. German pharmaceutical companies adopted quality standards observed in captivity. Hospitals reorganized following American models witnessed firsthand. The transformation from ideological to scientific medicine became permanent. The numbers reveal the scope. Total German PSWS in US 371,683. Medical facilities with German staff over 200. Documented medical education hours 100,000 plus. Medical procedures performed hundreds of thousands. Nursing schools established by returnees 15 plus documented. Hospitals reorganized on American models, dozens in U.S. zone. Each trained nurse influenced dozens of colleagues. Each reformed hospital treated thousands. The ripple effects multiplied exponentially. In 1995, surviving German nurses who experienced American captivity drafted a statement. "We served the Nazi regime and became American prisoners. We witnessed that medicine corrupted by ideology becomes death's instrument while medicine based on science and compassion serves life. Americans showed us abundance beyond imagination, medications, technology, resources. More importantly, they demonstrated medicine without hatred. They treated enemies as patients deserving equal care. We returned carrying more than medical knowledge. We brought understanding that healing transcends nationality and ideology to future medical professionals. Never let medicine serve ideology over healing." American doctors and nurses taught us this by treating enemies as humans deserving compassion. We arrived as prisoners. We left as witnesses to medicine's true purpose. The transformation of German nurses in American captivity represents one of World War II's most successful ideological conversions. They witnessed not just technological superiority, but medicine's fundamental purpose: healing without discrimination. Their journey from Nazi medical servants to scientific medicine advocates demonstrates experience's power over propaganda. Daily exposure to American medical practice accomplished what force couldn't: complete ideological transformation. The 9 nurses emerging from Cherbourg's underground hospital on July 2, 1944, represented thousands who would experience this revelation. They entered captivity believing in German superiority. They left understanding that medical excellence comes from science, resources, and universal compassion. This was America's greatest medical victory, demonstrating through daily practice that humanitarian medicine triumphs over ideological medicine. German nurses weren't just captured, they were converted through witness to medicine's true purpose. Their conversion laid foundations for post-war German medicine's reconstruction on humanitarian rather than racial principles. In their transformation lay proof that even the most indoctrinated minds can change when confronted with undeniable evidence of a better way. The German nurses captured by American forces discovered that their enemies possessed not just superior resources but superior medical philosophy. They had been taught medicine served racial ideology. They learned medicine serves humanity. That lesson learned in American captivity would reshape German medicine for generations. Their story stands as testament. Medicine based on science and compassion will always defeat medicine corrupted by hatred and ideology. The captured became witnesses, the enemies became colleagues, and through their transformation, medicine returned to its proper purpose, healing without borders. Science without prejudice, compassion for all who suffer.